Today's video is all about pain management, natural pain management modulation and regulation naturally, alternatives to opioids and addictive medications that are often hard to kick. I'm going to delve into the benefits of CBD oil and answering a ton of your viewer questions in today's video. Recently, Jerry Spinagle asked, is CBD oil good for pain management? I want to dig into the benefits of CBD oil on pain management, sore joints, sore muscles, aching organs, aching glands. So many different benefits exist when it comes to pain management, pain regulation, and pain modulation that I'm really excited to dig further into this. Welcome everybody. I'm Dr. Melissa Gallagher. I'm a naturopathic physician. I have personal expertise with CBD oil in my practice clinically, and I want to dig into why CBD oil is so beneficial for pain and why you should be considering it clinically if you haven't for your pain management protocol. So let's dig into the specific questions that often occur and revolve around CBD. I'm really excited to dig into the impact cannabinoid therapy, like using CBD oil, has on regulating your central nervous system and your nerve responses to pain. There's a really unique kind of pain cycle loop that occurs in the body. Simply put, we sometimes get in this like broken record. It's just this revolving kind of cyclic pain receptivity, pain experience that the body undergoes. And a lot of that has to do with imbalances and deficiencies in your endocannabinoid system. If you're wondering if maybe you might have an imbalance in that system, please check out this link right there where you can actually download a free quiz that I provide to you. It's a checklist. Basically, you tally your total at the end and it categorizes different deficiencies. And then it also makes recommendations in terms of how to use CBD for management. But let's dig into how CBD is so effective for pain. And there are tons of clinical studies. The European Journal of Pain has identified CBD and its benefits specifically on arthritis. There are multiple journal articles and clinical research surrounding CBD and pain management, particularly in cancer cases, ALS, Parkinson's, arthritis, chronic pain, MS, joint pain, muscle pain. For those of you familiar with my work, I do a ton of lymphatic work, and there are lymphatic disorders like lipedema that are categorized by painful limbs, painful extremities, and painful skin. I use CBD with so many of those cases because it actually helps our treatment protocol. What I want to do is explain a little bit about what CBD and the properties of cannabidiol in your body, how it works in stopping receptivity to certain proteins and compounds that trigger the pain response. So simplifying the science behind it, basically CBD is a binding agent that blocks certain compounds that trigger pain receptivity. That's pretty impressive because it doesn't necessarily mean that we're resolving the root of the pain source, but we're driving down the pain tolerance and we're driving down that pain experience. If you are a chronic pain sufferer, you know how awful, how debilitating, and how chronically terrible this pain situation is. It takes over your body, it takes over your life, it affects your chemical composition. And where I see the most benefit, not only from the mechanical, chemical benefits and composition of CBD impacting your pain receptivity and regulating your nerves and the response to pain, but it also has been clinically proven to reduce inflammation. This is really, really significant, friends. The significance here with CBD and lowering inflammation is that it literally lowers the inflammation in not only your brain, but your central nervous system and throughout your whole entire body. So a lot of times as a naturopath, what I look at with individuals that are dealing with pain is the underlying cause. It's inflammation. And that inflammation actually causes this kind of swelling experience. The swelling then presses on nerves. And then we have this whole nerve cascade that sends signals and the body registers that signal as pain, and you feel pain at that spot. Sometimes those nerve bundles, nerve sheaths are impacted. And for folks who have fibromyalgia, lupus, there are huge benefits. I have seen so many patients in my clinic who are prescribed really strong opioids, and essentially it's equivalent of like tranquilizing a horse in terms of pain. One of the amazing reasons that I love to recommend CBD oil for folks who are dealing with chronic pain and are seeing pain management providers, there is no negative impact on your liver. And this is significant. If you are dealing with intense pain and you've gone beyond taking aspirin or naproxen sodium, and you're now in the opioid or pre-opioid category, where you're taking really strong medications that have addictive aspects to them, and also tolerance levels that you continue to have to increase your dosing because your body becomes tolerant, there's a liver impact. And your liver, we need to be cognizant of your liver health with dealing with the inflammation, the pain, and just helping to balance your body. CBD has no ill effect on the liver. This is a significant benefit for individuals that I specifically help who are on those opioids, who want to get off of them, transition off of them. That middle space of that transition, we titrate down, obviously with working with your pain management team, but we can add in the CBD on top of that and ultimately titrate you off of the opioids without having an addictive aspect. I'm so excited to share this information with you, friends, because I know it will be helpful. If you're sitting here and you're watching my video and you are suffering and you're in pain, you do not have to suffer alone, and you don't have to suffer needlessly. I want to share with you one of my favorite CBD supplements. Oh my goodness, Gabriel tweaked my back like nobody's business, and I reached for my CBD oil. It is so clean and so full spectrum, just pure. It just gives us all the good stuff we need. This is what it looks like, and it literally is just a few drops that I place under my tongue. I hold for 90 seconds and boom, instant relief. I also paired this CBD oil with a topical CBD oil, and you've probably seen some of my videos here. You know, this is highly potent, but I like to incorporate CBD on all aspects in the body. You can do it topically, you can do it internally for maximum benefit of pain relief and pain management on a day-to-day basis or for an acute case. I recommend using your CBD oil. Do this at least 2 to 3 times a day, especially if you have pain that's interrupting your sleep. You definitely want to take a dose before bedtime. Pair that up with topical CBD infused creams and oils that you can apply on the muscle, like my lower back. That's where I applied my CBD cream. So I was internally taking it and then treating it topically, and boom, mama's back to normal and all is good in our household. This can be you, where you instantly get that relief.